Welcome back to Inspire Great Health. Today I have some very special guests, one who is a returning guest, and we're going to be talking about the Transcranial Magnetic Stimulation Therapy Machine. So, Ashlee, welcome back. Dr. Pelloquin, welcome for the first time.
It's nice to be here.
Very good. I'm happy to have you both here. So, Ashlee, you have been a returning guest, but go ahead and introduce yourself and talk a little bit about what you do, and then Dr. Pelloquin will go with you.
Yeah, so my name is Ashlee. I am the director of Outpatient Behavioral Health here with CRMC, and I'm really in charge of kind of the therapists, our front desk team, and helping the doctors do their job and manage their schedules. And so really just kind of all that encompasses our outpatient clinic. So.
Yeah, and I'm Regan Pelloquin. I'm one of the doctors here at CRMC in the outpatient psychiatry clinic. Usually we're doing kind of like intakes, just the outpatient care, referrals from inpatient, and of course working with our therapist on cases together. And now newly doing TMS.
Oh, wonderful. Well, welcome. So, tell me about the Transcranial Magnetic Stimulation Therapy Machine, or TMS. What does it do and how does it function?
Yeah.
I'm going to defer to you because you're the expert and I'll add stuff in. So that's why she's here. She's the expert on this. So.
Absolutely. So I guess the first thing to start with is that this is not a new technology. This has been around since the 1980s. We're just newly able to offer it. It wasn't something that was just accessible for a long time. So I think what I would want people to know is that it's not new. I think that can be kind of scary.
Sure.
We just can have people have it now. And so what it is a machine that rests a magnet against your head. It's about this size, like a 6-inch Subway sandwich.
Yeah.
Rests on your head. And it delivers magnetic pulses that create small electrical currents in your brain and that kind of wake up centers that we think are underactive in depression.
So it helps treat depression and anxiety and things of that nature.
Yeah, so right now the indications for it are going to be kind of depression, anxiety, and formally major depressive disorder, OCD. We're really hoping that as kind of things progress, there are going to be other indications that's approved for.
And those are the ones that are approved for insurance. So that's the great thing about it is major depression and OCD, those are covered by most insurance companies. And so as they do more research on other kind of diagnosis, those I think will get covered by insurance as well, which will be really helpful for people. Yeah. So.
And I also think from a visualization perspective, what is the machine? It almost looks like kind of like a dental office chair, but much nicer. So I think ours was designed, they said, by a German sauna expert.
Yeah, something with a massage therapist or something.
So very comfortable, kind of leans you back, and then the magnet is kind of just a small piece that kind of sits overhead.
So it's not intimidating to look at.
No, and we've tried to make it really comfortable for our patients too, and we'll talk a bit more about this, but the first initial visit's usually the longest, and then after that it's about 20 minutes. And so really people are in and out, they're not there for a really long time, and so that is, I think, really convenient in that sense that it's not like an hour every day. So.
And is it for all ages, or who does it treat?
So right now the indications are for age 15 and up. The adult psychiatrists like myself are kind of focusing on 18 and up, but I know that our child psychiatrists are also looking to get trained and be online as well.
Yeah. Are there any side effects people might notice?
Yeah, so in terms of side effects, it is extremely well tolerated. And so most of the stuff is going to be local scalp discomfort or a headache. And the reason is because we're kind of resting that coil right on your head. And the sensation is kind of like if you were to kind of take your finger and kind of gently tap your head. What they kind of, the way we describe it is, have you ever had someone sit there and just kind of tap on your head for 20 minutes? No. But you can imagine, it is annoying and uncomfortable. It's rarely painful, but you can imagine if someone was doing that, you may have a slight headache or maybe just some discomfort, but usually all of that gets better as people go on. There are some people who maybe are more sensitive to that, in the spectrum of how humans experience pain. But I personally, in my time with TMS, have never had someone have to discontinue treatment because of that discomfort.
So very few side effects, which is really great because a lot of people struggle with medication because of side effects. And so I think that is one of the reasons why TMS is amazing to offer to our clients is that, there are limited side effects with it. So.
I think an important thing to note is that this is not a treatment that's available for people with seizure disorders, just because there is a small increased risk with that. But other than that, it is fairly low risk.
Yeah.
Okay. Well, that's good to hear.
Yeah.
Yes.
Yeah.
If someone is more interested in learning more about this treatment, who would they call? Would they call BHS?
Yeah, so they can call our normal number at BHS, and what we do is we're going to put them on a list, and I'm really kind of going through all those people and talking to them individually, see what they're looking for. They'll then meet with a psychiatrist, of course, because the psychiatrist will answer all the questions that they need to, history, kind of their depressive symptoms, all of that stuff. And so they have a couple conversations with us, but if they're just interested to find out if they qualify, they can call BHS, and I'm right now calling everyone and kind of chatting with them before we get them with the psychiatrist. So yeah, they can just get on our referral list. So
Okay, fantastic.
And technically, no, I'll add that. So referral, no. They can just self-refer themselves. If they have a doctor that they're seeing, the doctor can also send over a referral, and it kind of falls into our work queue, and we get that. But if they're just out in the community and they want to call and learn more, they can self-referral. So
Okay. Is there anything else you'd like to add about the TMS?
I think the big thing today would be talking about like how effective it is. So one of my mentors kind of described it as like miraculous, and I think that's something that we don't usually like say in medicine all the time. With depression medications, they're wonderful, right? Like I wouldn't have gone into this field if it didn't help a lot of people. But for people with treatment-resistant depression, meaning that they have like tried a med, tried another med, tried different families of medications, the odds of you getting really good success as you continue different medications gets lower and lower. And obviously that's really discouraging. And then even besides that, there are a lot of people who can't tolerate the medications for side effects and this and that. And we see that people with TMS have incredible outcomes. So like 50% of people will have like 50% improvement, which I think sometimes when you hear it, you're like, is that big? But compared to our medications, I mean, that is huge. And some people really do have 100% like improvement of their symptoms. And so it is, I think, like a life-changing treatment that we did not used to be able to offer. I think another thing to note too is that you do have to be able to come in every day for 35 sessions, so 5 days a week. And that definitely is a time commitment, but the durability of the treatment is quite good. And so people at 1 year will often look as good as they did when they ended treatment. And I think that's also very encouraging, and thinking about like, do I want to set aside the time, and kind of like thinking about like, is this a treatment I actually want to pursue? You can also get retreated if you have good success with it. And so it's not like a one and done kind of situation. And a lot of other treatments like ketamine and things like that, like the durability isn't as good.
I do, and to kind of jump on what you're saying, I do love that, because I think a lot of people, you know, the autonomy of their own bodies, they don't want to take medication forever. That's one thing I hear a lot in therapy is, do I have to take my meds forever? Like, what is this going to look like with the side effects? And so that is the great thing about TMS, is it's, those 5 weeks might be every day, but after that, there's no maintenance, there's no like coming back in, only if you want it and you want to feel like, hey, can I do another round in a year or so? But it's not like anything after that. You're done after 5 weeks, which I think is great for a lot of patients, because they don't have to continue to do those things they don't want to do. So I think that's amazing. So, yeah.
And you said after the first treatment, it's only about 20 minutes.
Yep.
So patients could do it on their lunch hour
Yes,
if they wanted to.
100%.
And you said with very little side effects.
And go back to work. You know, we do
Yes.
offer EC2 here as well, but for some people going under anesthesia, that's not always easy for them every day. And so like, that is the great thing, is like, you 20 minutes, 30 minutes from your day, leave work, come get it done, and you're done for the day. And we're really trying to make it so that they're working times for everybody and they're consistent, so they have the same time every day. So we're really trying to make it as patient friendly as we can, because we know that it is a commitment, but we want them to be successful with this. So.
And you can drive there and drive home.
Yes.
Which is not
Yes.
the case with a lot of things and treatments.
And I think too, and Dr. Pelloquin can on this, but like, I think when you're getting on medications, there's a lot of like titrating or changing dosage and trying to find the right one. Whereas this one, we're not looking at like having to change stuff, or, you know, it's pretty fast ramp up. I think isn't it like a week or two before they start seeing some results? So I mean, that's encouraging too.
I think the other quick things to note too are that I think there's a question like, does this cure depression? No, it treats depression, but does a really good job when it works. The other question people say is kind of like in a similar vein, like, can I get off my medications? There's no like definitive answers. In general, what we recommend is that people stay on their medications. It helps decrease like them having their depression come back. But it's not like an absolute, and it's kind of case by case. And yeah.
So something that can be used in addition to other treatments.
Yes, 100%.
So, okay. Well, is there anything else? This is really fascinating. I love hearing about this.
I do like, and I do think Dr. Pelloquin said this great, is that like, this is something that has a lot of research, which is amazing, and like Cheyenne just hasn't had it. There are a lot of places in Fort Collins, Colorado that offer this, but we want to be able to offer it to the community so they don't have to drive for this every day. You know what I mean? There's a lot of clinics in Colorado, and so there's not a lot of places in Wyoming that are offering this, and so we really want to be able to offer something to this community that they would have to drive for. And so for us, that's really exciting. I know there's a couple other places in town that do it, but really trying to offer, you know, the insurance to help cover that. And so we're really excited to bring something that they would have to drive for normally. And so we're hoping that it can help reach a lot of our patients and people in the community. So.
Well, wonderful. I love that you guys brought this to CRMC.
We're excited about it. So.
Well, Ashlee, Dr. Pelloquin, thank you so much for joining me today.
Thank
I
you.
appreciate it. Yes. And thank you for tuning in. And if you are interested in learning more about this, go ahead and call Behavioral Health Services, and we will see you next time.